Willie King went into surgery to have his diseased right leg amputated. When he woke up, his right leg was still there, but his healthy left leg was gone. The surgeon had amputated the wrong leg, and then he tried to cover it up. February 20th, 1995. University Community Hospital, Tampa, Florida. Willie King, 51 years old, diabetic, had developed gangrene in his right foot. The infection was spreading. Doctors said his right leg needed to be amputated below the knee, or he would die. Willie agreed to the surgery. He signed the consent forms. Right leg, below the knee. It was written clearly in his medical chart. The surgery was scheduled for that morning. Willie was wheeled into the operating room. The anesthesiologist put him under. He fell asleep, trusting that when he woke up, his infected right leg would be gone, and he could start healing. Dr. Rolando Sanchez was the surgeon. He'd done hundreds of amputations. This should have been routine. But when Dr. Sanchez entered the operating room, he looked at Willie's legs. The surgical site wasn't marked. Nobody had drawn on Willie's leg to indicate which one to amputate. Dr. Sanchez looked at the chart. It said left leg. But it didn't. The chart said right leg. Dr. Sanchez misread it. He prepped the left leg, the healthy leg. He applied the tourniquet. He made the incision. He began cutting through muscle, bone, and tissue. Halfway through the amputation, a nurse noticed something. "Doctor," she said. "The chart says right leg." Dr. Sanchez stopped. He looked at the chart again. His face went pale. He'd been amputating the wrong leg. But it was too late. The left leg was already destroyed. He couldn't reattach it. The damage was done. He finished the amputation. He removed Willie's healthy left leg. Then he bandaged the stump. And then he did something unforgivable. He didn't tell anyone. He wrote in the surgical report, "Left leg amputated as planned." He changed Willie's chart. He crossed out right and wrote left. He told the nurses to say nothing. Willie woke up in recovery, groggy, in pain. He looked down at his legs. His right leg, the infected one, was still there. His left leg, the healthy one, was gone. "What happened?" he asked the nurse. "Why is my right leg still here?" The nurse looked uncomfortable. "The doctor will explain." Dr. Sanchez came in. He stood at the foot of Willie's bed. "Mr. King," he said calmly, "we had to amputate your left leg. The infection had spread." Willie stared at him. "What?" "No. The infection was in my right leg." "You were supposed to take my right leg." "The chart said left leg," Dr. Sanchez said. "That's not true," Willie said. "I signed forms for my right leg." Dr. Sanchez left the room. Willie demanded to see his medical records. The hospital refused. He called his family. They called a lawyer. The lawyer subpoenaed the records. And that's when they discovered the cover-up. The original chart said right leg, but someone had crossed it out and written left. The surgical report had been falsified. Dr. Sanchez had tried to hide his mistake. The story broke in the news. National headlines. Surgeon amputates wrong leg, tries to cover it up. The hospital launched an investigation. They found that Dr. Sanchez had violated multiple safety protocols. He didn't verify the surgical site before starting. He didn't mark the leg. He didn't do a timeout to confirm which leg to amputate. And when he realized his mistake, he falsified records. Willie King sued. The case settled for $900,000. Dr. Sanchez's medical license was suspended for 6 months. Then he was allowed to practice again. Willie King had to have his right leg amputated 2 weeks later. He lost both legs because of one surgeon's negligence. This case led to major changes in surgical safety. Hospitals now use checklists. Surgeons must mark the surgical site with a permanent marker before surgery. Teams do timeouts to verify the patient, procedure, and site. But for Willie King, those changes came too late. He spent the rest of his life in a wheelchair. Both legs gone. One from disease. One from medical malpractice. This is true medical horror. Real cases, real victims, real negligence. Subscribe for more stories the medical industry doesn't want you to know.